Good morning, good afternoon, good evening, depending on where you're joining us from today. Thank you so much for taking the time to join us for this online information session about the Health Policy and Law program. I'm Chris Van Nostrand from the HPL program, brought to you by UCSF and UC Hastings. Delighted to be joined today by my colleague Gregg Cochran, one of the leading faculty members involved in this program. Gregg brings a wealth of experience, both as a practicing physician and then for the last 15 years, as a lawyer in healthcare in the healthcare law space and policy space. So we're really excited to bring him on board to talk a little bit more about his views from the industry and how that's informing his role in designing the program. So I'll turn it over to Gregg in just a moment, but just a quick note on process here to begin. So we'll spend about 30 minutes here hearing from Gregg directly on some topics I think that are really interesting. We'll then spend the next 30 minutes getting to your questions. So do go ahead and submit those questions now, but know that we won't get to those until a little bit later. So with that, I'd like to turn it over to Gregg. And Gregg, thanks so much for taking the time to join us today.
Great to be here, Chris. Thanks for asking me.
So let's start with the big picture. What is the current environment like for healthcare? If a student wanted to enter this sector, what could they expect?
Well, it's a really exciting time to be entering this field. There are a few fundamental forces at play in the industry. The first is a real substantial redesign of our incredibly complex healthcare system. This is mostly driven by the passage of the Affordable Care Act, which I think most people have heard about by now. There's also a push to develop more strategic approaches to managing costs and services, in part due to our understanding of the relationship between those factors. It's becoming clear to us more and more all the time that increased cost doesn't necessarily result in better services. And we know now, for example, that prevention and early intervention is really critical to reducing healthcare costs and spending.
And so addressing those kinds of issues is where the HPL fits in, right?
That's right. The complexity of the system really puts a huge demand on providers and payers in terms of understanding the system and our compliance efforts. Because the system is so complex, and I keep sounding like a broken record with that, healthcare providers, administrators, and attorneys have to spend so much time on the job really learning the ins and outs of our healthcare system, including the Affordable Care Act. And even most health law attorneys are experts in only really small parts of it.
So what type of education is currently available to students who are looking to navigate this system and make a real impact? And maybe how does HPL differ from some of those current options that are available?
Well, certainly one path, a traditional path, would be to get a law degree, and many law schools now offer a health law concentration, such as Hastings. But that's really overkill for a lot of students who don't really need or want to practice law. Other programs, such as healthcare administration or one of the professional degrees, such as nursing, medicine, those simply don't cover much about health law and policy. So the HPL program, which only takes a year of study, provides students with a broad-based understanding of our entire healthcare system. And this dual perspective in the legal and policy aspects of healthcare is really quite rare in programs of this nature.
How so? Can you expand on that?
Well, as I alluded to, most degrees in law, business, healthcare administration, public health, medicine, and nursing don't really prepare students to help their organizations with legal compliance and legal policy. Those issues are really just too complex to cover in depth on top of the main focus of those types of curricula.
And can you talk more specifically about how students will benefit from this type of education and what can they really, at nitty-gritty level, expect to get, maybe depending on some of the different pathways that they might be coming from as well?
Yeah, that's right. I think it really does depend on where they're coming from. This degree is a huge help for professionals professionals, administrators, and or executives who might have had not a lot of instruction in health law and policy. It can lead to leadership roles at various types of institutions. The program is also ideal for folks who either don't want to practice law, like I mentioned earlier, or for lawyers who do want to acquire a deeper understanding of the issues. And I think paralegals who work with healthcare attorneys would really benefit from the HPL and would open up doors and opportunities for them. We're seeing more and more law firms really going into health law specializations and having paralegals and other professionals that help them with support those goals. And even an early career attorney who's already in practice, I think, and interested in practicing healthcare law, it would make them more valuable. I mean, I've been on the side of hiring associates, and if I saw an applicant with an HPL on their resume, I think that person's absolutely got a leg up in terms of getting a job compared to somebody else, even somebody else who might have come from a more highly ranked law school. And of course, another obvious career goal for some HPL graduates is in healthcare compliance. That's a really demanding and challenging field that doesn't really require a law degree, although a lot of compliance officers do have law degrees. But a program like the HPL will really prepare someone well.
And what about those students who are looking to start a career in health policy? So a little bit more on the policy side, maybe less on the legal side.
Well, those folks will definitely acquire a solid foundation in healthcare law and policy. And as folks probably know, there's an opportunity to focus on one or the other in the program by choosing either the health track, the law track, or the policy track. And the track that the students choose will really depend a lot on what their interests and career goals are.
And how do the two main tracks in policy and law ultimately align with some of those different career objectives? I know the faculty you included have spent a lot of time really making sure that what's happening within the policy and law tracks is specific to some of the interests and some of the more practical, again, and sort of career-oriented aspects of what students might want out of the program.
Yeah, that's right. We refer to the health, we sort of talk about health policy as driving health law. That's kind of a really good way to think about how they interact, meaning that we can't really develop effective laws until we understand the underlying policy issues and trends, which is a very sort of quantitative and qualitative research field, really. So depending on the student's experience and interests, they may want to prefer to focus on studying either the underlying policy issues that affect society, or going into health policy. A health policy expert might look at whether a publicly funded healthcare program improves quality compared to the private sector. Those studies can be used to support arguments for or against publicly funded programs. So those folks who would prefer to study those underlying premises of healthcare issues, or in acquiring a more quantitative and qualitative understanding of the foundations for the policies, should really think about the policy track. That training will prepare those students for work in policy research companies, doing legislative work such as lobbying, being a policy analyst, a legislative analyst, or advising the private sector in the consulting field.
So this is an interesting topic, so maybe we could keep building on this then. So what about those who are more interested in becoming healthcare administrators or providers, taking on a leadership role with a provider? I'm curious how that might be specific to them then.
Well, if students are more interested in that role, becoming healthcare administrators or providers, like, historically a lot of physicians and nurses sort of move into leadership roles as they advance in their careers, providers with leadership roles, the law track will provide a great foundation for those people because they'll learn a great deal about how the law influences the business of healthcare, as well as how to ensure legal compliance within their organizations.
So because this degree is so broad and gives such a broad understanding of healthcare, law, and policy, can you describe some of the specific types of topics that students will study? And maybe how could that influence the capstone project? I know that's something we'll probably talk more about, and students may want to know more about the capstone, but just for now, I suppose, what are some of the specific sort of in-depth areas that will be addressed in the curriculum?
Sure. The HPL curriculum is designed very thoughtfully and very carefully to provide an excellent background in the important legal issues facing healthcare providers, payers, policy experts, and lawmakers. One way to think about the material we cover in the HPL on the legal side is to think about the American healthcare system as involving what I call the three Ps, the three main constituents of our healthcare system, patients, providers, and payers. The HPL curriculum presents the substance of the healthcare system as how it affects those three constituents.
Can you give an example of that?
Sure. After the introductory course in the U.S. healthcare system, on the law side, students will take a course called Providers and Patients. That course builds on what they learned and digs a lot more into the specific legal issues that arise in the relationships between those Ps, the patients and providers. Examples include medical malpractice, medical ethics, consent, medical research, and the like. On the other hand, another course, the healthcare finance course, focuses more on the relationships between two different Ps, the payers and the providers, including Medicare and Medicaid, as well as private insurance, managed care, et cetera. In that course, students will get a solid understanding of the legal issues that arise out of those relationships between and among the payers and the providers.
So as we've mentioned, this program has definitely been meant to be practice-based and very practical to students. So could you describe maybe an example of how a student would apply a lesson that they've learned from class and bring that into their position?
Sure. I think most experienced healthcare administrators and physician and nurse leaders who are learning this material on the job, for example, will probably not have been exposed to this breadth of material. And that's because those kind of leadership positions really focus on certain parts of the system, such as quality or research or employment issues or Medicare compliance. The HPL, unlike law school and medical school, is built so that students are really learning by putting the material into the context of practical issues, those that are relevant to the business of healthcare.
So can you expand upon that practical context a little bit and how that differs from other programs? You sort of alluded to this at the beginning, and I think for many applicants and prospective students, this is a key question, which is there's a broad universe of possibilities for pursuing graduate study.
Mm-hmm.
The HPL is new. How does it fit into sort of that ecosystem of graduate programs? How is it unique?
Yeah, and it's a challenge because we have folks from different degrees and we're teaching the law. So our experience has been in how we teach law. In law school, students take health law courses because they want to be trained to be able to identify legal issues and to make legal arguments to help their clients. In the HPL, on the other hand, we're still going to be teaching the law, but we know that not all the students have legal training. In fact, most of our students probably will not. So there'll be more of a focus on the kind of the clear rules of law and when to ask for legal help as opposed to really the skills to train a lawyer. I might add too that the HPL could be an excellent program for somebody who's thinking about going to law school or medical school, maybe wants to become a healthcare attorney, but isn't quite sure yet. So I think the HPL would give a great understanding of the system and a taste of what it might be like to become either a healthcare attorney or a physician or even a healthcare administrator.
I know one of the things that we were really excited about too in discussing the origins of this program and moving forward with it was the number of students who are out there who may be thinking about even broader programs like an MBA or a public policy degree or a public affairs degree, which are quite generalist in nature and provide some opportunity to specialize.
Mm-hmm.
But in this case, the specialization is really around this core area that's so important in so many different ways, which again I know we'll get to a little bit later in this concentration or in this conversation. I think the other component of that that's really interesting then is just the sheer mix of backgrounds that you're getting. So I'm wondering how you've thought about sort of the mix of backgrounds, professional aspirations, and how students will be mingling together in these online classrooms.
Yeah, well, healthcare policy and law is shaped by input from a variety of perspectives. And so I see the HPL itself really as kind of a mini think tank of sorts for students to consider support and advocate for various positions on healthcare issues.
That's really interesting. So then what are some unique ways that, say, a liberal arts graduate can contribute to that think tank environment? Maybe they don't have a medical background, they haven't been to law school yet, they've studied more of a sort of traditional liberal arts program. How would they be able to make a difference?
Yeah, that's a great question. I mean, we may have a student come into the program with an undergraduate degree in something like art history or philosophy, maybe no healthcare experience at all. But even that person can still add great insight based on their personal or family history or their experience with the healthcare system. So that viewpoint will be valued in the program just as much as the viewpoint of a seasoned hospital administrator or a lawyer or those folks who've really been trained on all the different healthcare laws and policies.
Interesting.
Yeah.
So, and then I guess from another perspective, the HPL is teaching sort of on-the-job skills in a relatively short time. From a medical standpoint, where do you see graduates heading?
Healthcare providers, as I've mentioned, as well as hospital administrators, healthcare administrators, folks that are executives in health plans, insurance companies, those folks will get an excellent understanding of the legal framework and the work that they do. Physicians, nurses, and other providers will really learn how to understand how the law influences the work that they do. I know a lot more about the law than I was ever taught in medical school. So this is really true for those who are in hopes of getting into leadership positions such as like chief medical officer roles or chief nursing officers. medical staff officers, quality control executives, and managed care executives and the like.
And maybe an example of that too?
Well, a quality expert, as I mentioned, they have to understand the confidentiality issues and the privileges and immunities related to peer review. So when somebody's running a peer review committee, they've really got to understand, how to protect that information and how the members of the committees that are handling those kinds of issues are going to be, protected by the law. Another example, providers and hospital administrators might learn about the legal issues related to malpractice. Consent law, there's issues that come up all the time in the hospital setting, medical ethics, all of those help those folks to really, to determine how to best approach those issues when they come up in their different organizations.
So let's delve a little bit more into then some of those issues. And certainly we've identified the value that HPL brings professionally, and there's going to be a plethora of jobs available for students in this area. But we would think that most of our students also are really looking to make an impact and looking to make a real difference. So how would those professional goals and also what students are learning really lead to a direct influence on shaping healthcare issues both today and in the future?
Yeah, that's a great question. Healthcare, I think everybody agrees, is and will continue to be a hugely relevant and important issue in our society for decades to come. Experts in the field differ certainly a lot on what aspects of it are more problematic than others, as well as on the best approach to solving the different problems. But health policy research is increasingly helping us to really identify the relevant issues and to show quantitatively and qualitatively how to address them. But the differences in opinion, often politically driven, will continue to influence how our laws are legislated and interpreted.
This sounds like it will be a perpetual debate.
Yeah, the issue of whether healthcare should predominantly be private or publicly funded, I think, is one of the fundamental issues. That will continue to be a major theme in our policy and political landscape. The Affordable Care Act created a lot of new and really strikingly different approaches to providing and paying for healthcare. So there's a lot of work to be done just around the ACA and determining whether those approaches have become successful. Within state and regional markets, the choice on how to structure the business of healthcare really varies on a lot of factors. And that includes patient demographics, provider access, population health, and even climate and environmental issues, not to mention the political leaning of that region's lawmakers.
So maybe just to expand on that, talk about some of the regional differences that could come into play.
Yeah, here's a great example. So one of the things that came out of of healthcare reform is an entity known as an accountable care organization, or an ACO. It's kind of like an HMO, but different. So that's a relatively new concept that's coming out of healthcare reform. And we've already seen that in one region, a group of providers and payers structure an ACO in a way that they think works, and it turns out that it does work, and then it demonstrates a great amount of cost savings and improved outcomes. But you take the same exact model in a different region for lots of different reasons, and for whatever reason, it just hasn't become as successful. And we're looking at why that is and how that's starting to, what the factors are that are going into that. And we look at another area where providers and payers are always going to be looking at expertise is in fraud and abuse, healthcare fraud and abuse. The laws pertaining to healthcare fraud and abuse are really, they're numerous, they're very complex, and unfortunately, they're sometimes surprisingly easy to run afoul of, even with the best of intentions. So healthcare attorneys are invaluable to their providers and payer clients, but if those organizations have already started kind of looking at that expertise, from within the organization, especially earlier on in the process, to be able to structure really good compliance programs, they can help the company stay out of trouble long before there's ever really a need for someone to make a mistake. And I could list countless other areas in health law that I see have a current and future need for this kind of expertise. But I think HPL graduates will really be very well suited to market themselves to providers, for payer organizations, legislative advocacy organizations, health policy organizations, nonprofit advocacy organizations, and really the list goes on. And certainly for those students with professional training, such as law or medicine or nursing, or those who already serve as providers or administrators, they're really going to enjoy a very unique understanding of healthcare law and policy issues that will help them a great deal in their clinical and administrative roles within their organizations.
That's fantastic. I think that's a great place to maybe transition at this point, um, and get some questions from those folks who are listening in today and watching. So one question that has come up already today and has come up in some of our conversations is about the capstone project. Maybe any advice you could give to students on coming up with the topic, particularly since we certainly know from our perspective, having worked on this program, that the clearer that a student comes into the program with an idea of what they want to study, we think the more successful they'll be. So I think it's a positive thing that students are really starting to dig into this. So what would your advice be in students coming up with a topic for this?
I think the good news about that is that it can be almost anything. If you have an interest in something that in any way, shape, or form relates to healthcare law or health policy, that's something that you're going to be able to explore with your capstone project. So all the students in the HPL enroll in what's called the HPL Seminar, and that's a course taught by our two consortium directors, Professor King and Professor Dohan. And throughout the year in that course, or the 2 years for those who take the 2-year option, they'll be talking about and thinking about and starting to bounce off ideas about what the capstone project should be. And it can be anything. And as we've talked about, healthcare is so broad, so complex. It could be anything from needle exchange programs, how Medicare is changed with the Affordable Care Act, medical staff issues. There are just a ton of issues that go on. I mean, that students can talk about and look at from a policy perspective.
It sounds like what's really important then is that it's meaningful to students and something that they really want to dig into and will be intrinsically motivated by over the course of the program.
Yeah, I think that's right. I think folks who sign up for this program or who enroll in the program have already sort of demonstrated an interest in this area. And, you know, I think the HPL is really great in not only providing a good solid foundation of actual specific material, but then being open-ended enough within, you know, the capstone project and the HPL seminar for students to really go out there and explore things that we may not have talked about in enough detail, because 1 year isn't really enough time for you know, someone to become an expert in any particular area.
Absolutely. So the first question then, or the next question rather, that we'll take, more specifically, how do you think that this degree can help doctors as a former physician, someone who went to medical school first before transitioning into the law? This seems ideally suited for you to answer.
Yeah, you know, I always joke about how I just, it kind of, in fact, it kind of scares me sometimes to think about if I knew then what I know now about the law when I was practicing medicine. You know, physicians really don't get enough legal training in their medical training about the laws. I mean, everything from prescription drugs to how Medicare works to how insurance reimbursement works. You know, and as a healthcare attorney, having lots of clients that are physicians, I've seen, you know, where things go wrong. And unfortunately, it's almost always not with any kind of malintent. So I think physicians who either just want to really kind of get a better grasp of the law, especially if they're going to be growing into leadership roles within their organizations, either becoming leaders within their large medical groups or leaders within a hospital system and becoming like a chief medical officer, that kind of thing, the program would be invaluable to folks like that.
Great. So another question is this program intended to be more of a professional than an academic graduate program? And it looks like there's a second part of this question that we'll get to, but let's focus on that one first.
You know, I really think it's both. I mean, we do really think about and design the program around allowing students to have a degree that would help them get jobs. I mean, it's definitely a career training opportunity, but recognizing that policy, especially on the policy side, I mean, that is an area where some folks might be more likely to go into something like research or academics. So it would be a great introduction for people who might want to go on after that to get into some sort of maybe a PhD program in policy or go into another sort of administrative training program. But you know, first and foremost, I think we're really trying to put a product out there that helps people to have a credential that will help them in the job market.
Got it. Yeah, the follow-up question to that, which I think you answered, was, are there opportunities for those more interested in graduate research than in applying the program's content to enhance their professional lives, and in parentheses, undergraduate research, contributing new knowledge? And you mentioned the PhD track. Talk about maybe a little bit about PhD programs and what type of research could be conducted that might be relevant.
Yeah, I mean, I think, you know, if you're not, you know, PhD is a huge commitment. It takes a number of years for even the smartest folks to get a PhD. And, historically folks have gotten master's degrees along the way, but this is a really nice one-year program, or two again if you want to make it two, but a short program where you can really get a good sense for whether you've got kind of the feel and the passion for those kind of issues. So, unless you're just already kind of sure, and most people that are, will just go ahead and enter into those programs. But if you think you might have an interest in policy or even in certain kinds of legal academic areas, but aren't sure you want to commit to that length of a program, I think this would be a really great way to kind of get a sense for that.
Great. A really interesting question coming in here. For a person that has vast healthcare administrative experience, including legislative, quality research, et cetera, would this degree be helpful? I am wondering if I already have had this training. This is an interesting question in part because one of the things we heard recently from Dan Dohan, who's another faculty lead and one of the people who helped develop this program from the UCSF side, is that the HPL program can really be a tremendous accelerator for those earlier in their career. As he described it, you can learn things in this program in 1 year that normally you'd have to sort of stumble across over the course of 5 years. Mm-hmm. But I'm wondering to that person what you would say, again, if they already 20, 30 years on the job, mm-hmm. what could they expect, or could they expect to learn things that would be new that they could bring to their role?
Well, first of all, we would love to have that person in the program because they would be an incredibly helpful addition to the program to help other students. It's possible that someone even with that much experience has had kind of an exposure to all the different areas that we've taught. And I would encourage that person to really take a close look at the curriculum to make sure. But, I think that even somebody with that much experience is going to get some training in some areas that they haven't been exposed to yet. And I think that especially if they're interested in kind of looking more at the policy aspect, they'll have a chance to come up with their own independent project for the capstone project that they haven't done before. And, I still think it would be a really valuable help.
This strikes me as a great example of where the capstone can be valuable because even if you have substantive experience, you might not have really delved into a particular topic or a project where you can establish some major expertise and some major bona fides. And maybe it's a policy or policy law or health law issue that has real resonance in the particular district that person is working, if it's in a legislative role or within the particular healthcare system or healthcare practice that they might be working.
Absolutely. That's exactly what I was thinking about. Somebody in that role, if they're already in a position, either with the government or in a healthcare system or in a healthcare payer role as with a managed care plan, that person can use this opportunity to really do something of value for their own institution. I mean, you talk about being able to kind of, really come up with something that maybe even use data from their own institution to be able to do that project. So I think that's an excellent place for someone like that to do that.
And maybe serving as a little bit of a change agent too. If you have a lot of experience, you've been in the industry, and you have contacts and colleagues, and you know the system. One of the things that this program could then bring is the UCSF and UC Hastings kind of imprimatur, right? A little mm-hmm. bit of outside credibility, almost like being sort of taking on a consulting role internally, right? That you've studied with these two really well-respected academic institutions, and you're bringing new insight more than just you have over the course of your career.
Yeah, that's right. I mean, even the most seasoned healthcare person is going to always learn something from their colleagues in a program like this, either not just from the professors, but from the other students in the course. And frankly, it's another networking opportunity. I mean, a degree program and school today is a great way to meet new people. If you're in a for-profit business, you're going to develop new contacts, new networks, while at the same time really developing a lot of great academic contacts and connections.
I think we mentioned this at a program discussion a few weeks ago that the Philip Lee Institute at UCSF in particular is one example of how deep the ties are into the policy world, in particular in DC, but also at the state level. And I believe the anecdote was that there's a Philip Lee himself and other prominent folks within that institute, which is in some ways kind of the home for the HPL program on the UCSF side. Those folks have been prominently involved in the Clinton administration and the Nixon administration over the years. So there's a really robust, as you pointed out, network. And that's just from the UCSF side. It doesn't even go into all of the folks that you might meet and might gain access to on the UC Hastings side.
Yeah, that's right. I mean, Hastings is very fortunate to be affiliated with UCSF through the consortium that's putting on the HPL program. I mean, UCSF is a world-class organization, probably the top healthcare university in the whole, I would say, in the whole world, frankly. But even on in the law side, we've got amazing faculty over at Hastings. Hastings is becoming an up-and-coming, well-recognized health law program. I just came back from the Health Law Professors Conference, and it's very clear that Hastings is starting to make a real mark on health education, health law education, and so it's a really exciting place to be right now.
And potentially a future U.S. Senator as well as a UC Hastings grad. So we'll see how that plays out.
That's right. That's right.
Would this degree be a good stepping stone to transition from healthcare to law? I think probably gets at that question you pointed out. Doesn't grant a JD, but other ways that you could participate in the legal field.
Yeah, absolutely. I mean, I think if somebody is wanting to go into law, but they're definitely not quite committed or they don't know for sure, I think that, the HPL would be a place where they could spend a year, get a very good feel for it, and then make the decision. Or maybe they decide that they still don't need a full law degree even after they do the HPL program, depending on what kind of law job they'd like to have.
And then building on that, this question, some relevance to that, does the policy track focus its attention on federal or California health policy?
That's a great question. And I'm focused a little bit more on the law side, so I'm not as qualified to address that kind of a specific question. But in general, the program on the law side I'll talk about first. We are going to focus on as much as we can on federal law. But because California happens to be not only one of the biggest states in the country, but one with one of the most highly developed areas of law, especially in lots of different areas where the state law really governs, we will be using California as a model for a lot of different ways to teach about the law. And I think that's probably going to be the case in the policy track as well. Although in policy, it tends to be a little bit less specific toward state versus federal, though depending on what kind of issue you're looking at. Certainly like Medicaid, which is a state-run program funded by the federal government, there's going to be issues of both if you're looking at a policy issue within the Medicaid program. But I think that the answer is that we try to make it a program helpful to people from all over the country, even all over the world. But to the extent that we're lucky enough to know and understand the California law here and in this faculty, we're certainly going to take advantage of that.
Absolutely. Somewhat, again, building on that, a really interesting question. How can we figure out whether to follow the health law track or health policy track? And maybe you could answer this both from a perspective of when that choice needs to be made, when do students actually need to effectively declare or focus, and also what kind of faculty advising is available and academic advising is available. I think that would help these online students know in particular that they will be in really well cared for, and there's quite a bit of attention that's going to come from the schools.
Yeah, absolutely. Doing a program in an online distance learning environment is a challenge because you're not there every day. But we have gone to great lengths, and the folks at Berco that are helping us put on the program have shown us all the different ways that we can make sure that we provide those same kinds of services to the students, academic support and mentoring and counseling and that kind of thing. So they will have those opportunities. The faculty members on the law and the policy side will be there to help them talk through these issues and help them to figure out which track they want to pursue. I don't know actually yet when we've decided that students are going to have to declare their track. I think that they're going to be able to take at least the first quarter and get exposure to both types of work before they decide. And it's really just going to depend ultimately on what your career goals are. And I think that if you know that or have a sense of that, or at least have a sense of what you're interested in, then we'll be able to help guide you toward that decision.
And I saw a question come up, I think that's probably maybe predicated on that last answer too, which is, are there going to be opportunities to network with both peers and faculty? Will be able to talk to instructors and professors. What will the interaction be like?
Well, it's going to be as closely analogous to a live program as possible. I mean, we're going to have, your students will not be experiencing live didactic sessions very much. Most of the material that they will be viewing from a media perspective, either lectures or interviews or PowerPoints and those kind of things, are all going to be done ahead of time. They're professionally produced, and they're very focused, and they really provide as much information as a law professor might be able to get to a class in a session that's maybe 3 times the length, just because it's being approached from a different perspective. But otherwise, the professors are going to be there. We're going to hold office hours. We're going to have open chat rooms for that sort of thing, both live and by email and that sort of stuff. But we hope to be just as available to folks as they would have availability if they were in a live program.
I think one of the things we've found through running online degree programs is that in many ways, because you can't count on the serendipity of running into a faculty member on campus, there's almost more interaction built in because there's a lot more structure and a lot more attention and just a lot more focus around making sure that when there are office hours, those are really dedicated seeing as many students as possible. And I know faculty are unbelievably responsive on email, and they'll do Skype calls and phone calls because we do want to make sure, and we are so committed to having students have a great academic experience.
Yeah, that's right. And those of us that have gotten involved in teaching the HPL are very sensitive to that, and we understand those issues. But at the same time, distance learning is really all about giving some flexibility to the students. And so, they don't have to show up at 9 o'clock every Tuesday and every Thursday. They can play the videos, and they can, do the material at their own pace, as long as they get the assignments in, and as long as they participate in the different discussions that are going on. It really adds a lot of flexibility for those folks.
So another career question, if a person is interested in making a career change, will this program help with that, such as through choosing the correct capstone or a research project? I think this is something, again, that we've touched on a little bit, which is that definitely coming out of the program, not only do you have the credential and the backing of UCSF and UC Hastings, but to that question, you have this capstone that establishes you as a real subject matter expert in a very topical area. So maybe just kind of build on that a little bit for the student.
Yeah, sure. I mean, I think, it depends on what career change you're thinking about, of course, but if you're thinking about some kind of a change that involves health law or health policy, this is really a great place to think about starting if you're not otherwise sure. I think just, again, focusing on the fact that it's a flexible program, it's very comprehensive in terms of the material that we offer, and as you say, the capstone project is your chance to really kind of look at something that's important to you that you might want to pursue later on, or that, as you say, Chris, can help you sort of put your name out there as being an expert in that area.
Great. Really interesting specific question that has come up, and I don't think we've hit on this one yet, so we'll take this. Would this program prepare a physician to serve on a board for a biotechnology investing company? Your thoughts on that, Greg?
Biotechnology, well, to the extent that biotechnology these days is biotechnology is something that's, of course, in the forefront. Compliance issues. A biotechnology product has to, depending on what it is, it's going to have to either meet FDA approval. It may or may not have to be approved by Medicare if it's something that a Medicare beneficiary is going to benefit from. And if a physician on that board has the technical knowledge and the medical knowledge to help that board to choose wise investments and to understand what those compliance and legal risks are, then they're going to be add a lot of great value if they also know about the legal and policy, or in this case probably more the legal stuff. Policy may or may not be as relevant to someone like that, and someone with that goal I think might gear more toward the law track.
Right. That's very interesting, right. So it's almost, for someone with this program under their belt who's serving in this kind of advisory investing role, risk mitigation might be huge, right? Thinking about how to, as you said, comply, particularly if it's like an emerging technology or something where it's a little bit more of a gray area.
Yeah, I mean, if a company like that is looking at different investments, I mean, we know now that we don't just look at the likelihood of or at the business model. They don't just look at what the management skills are of the executives, but We look at the risk that that product might incur through the compliance issues and funding and FDA compliance and Medicare compliance. So yeah, I think it's something that would add great value to somebody like to a board that does that work.
Great. Next question. Loving how specific these are getting. This is great stuff. Will this program help students prepare? Will this program help prepare students to operate within an ACO or value-based care model?
I'm not sure what the student's role would be in that, but absolutely, you know, as I mentioned earlier, the ACO is one of the new modalities or new approaches to healthcare. It's one of many different kinds of approaches that the Affordable Care Act is really sort of pursuing and promoting. We're looking at all kind of different ways like the ACOs or like value-based care models or patient-centered medical homes that are hoping to show a better care with less cost, because we know that if we can get patients in a situation where they're looked at by all the right constituents and have, you know, maybe not a doctor making a house call every day, but maybe having at least a nurse calling in once a week, and those kinds of models that really kind of keep the person in the system, they're going to do so much better, and we're going to save a lot of money on getting them out of trouble later on. So if someone's interested in kind of learning how to run an ACO or work within an ACO, yeah, absolutely. The HPL program would give the legal background on the Affordable Care Act to really kind of give them the ins and outs of sort of what it takes to do that. I don't know that the HPL would be necessary if that's sort of your specific career goal, but it certainly would be something to that would add to your credentials.
Excellent. So we've talked a little bit about some different graduate programs and how they compare to HPL, and again, the unique role that HPL fills. Another question has come up specifically about the MPH, and so can you compare the expertise track the HPL program will provide with a more traditional degree like an MPH, which is not one that we specifically brought up earlier. And I do think that that's an area of overlapping interest. We hear a lot of students who are thinking about both.
Yeah, that's right. You know, Masters of Public Health is really a different thing. I think that if somebody's interested in public health, in epidemiology, in the way disease progresses through a region, or the way that needle exchanges work, and the way that different kind of policies ought to be looked at in terms of improving public health, I think there is a lot of overlap, especially with the policy side. So, you know, I think the HPL would really give somebody who's interested in public health a great background in looking at in getting the policy expertise that could really kind of help play into the MPH. It might even help them come up with a project that they might want to consider pursuing further in an MPH program. Or if they've been through an MPH program, I think that they might want to continue on with that through their capstone project through the HPL. So I think there's a lot of synergy there. I think that if somebody's specifically interested in really kind of doing public health, they probably want to look more closely at a public health master's degree first. But again, depending on their goals, it may or may not make sense to do the HPL also.
I think one thing that's different as well between a public health degree and the HPL is a public health is a much more sort of, it's an existing curriculum that's really been taught in a certain way for a very long period of time, because public health just as a discipline is pretty mature, whereas in HPL, the curriculum has really been designed from the ground up, brand new, to reflect, as you mentioned earlier, some of these major complexities within the healthcare system. So it's a difference too, I think, in terms of kind of the where the curriculum is basically in the various evolutions of those fields.
Yeah, that's right. In public health, the master's degrees in public health are really going to be focusing on a little bit more kind of the provider aspects of health care and managing health care and measuring disease, all that kind of thing. Whereas the HPL is going to really get more into the legal part of it that I think most MPH programs probably don't cover.
And a similar question, how is this program different from a healthcare informatics program?
Oh, that's interesting. I actually don't know that much about healthcare informatics. I do have a colleague who I was worked with at one of my law firm jobs who just got a PhD in healthcare informatics. So I can't really speak to that too well, but yeah, I'd be happy to look into that and come back later with some more information on that.
If the student who asked that question wants to send us an email, reach out to either an advisor or respond to the email that came out with the invitation to this event, then Greg or someone else in the program would be happy to get you a more specific response to that.
Yeah, I do know that healthcare informatics is a very specific discipline. It's also a fairly new discipline. It's starting to have its own sort of up-and-coming era right now, and if I think that if someone's interested in that and know that they're interested in that, that's probably going to be the focus that they should take. But happy to answer more questions about how the two might work together.
A curriculum question. How does the curriculum align with that offered at UC Hastings? Maybe are there similar courses to what you see in a JD? How does this compare to, say, the 1L, 2L, 3L kind of model?
Yeah, that's a great question. We actually did, we're fortunate that Hastings has so many great health law courses already. So we were able to use some of the curriculum from the law school and the JD program to kind of be the starting point for the HPL course. And, but being very sensitive to the fact that a lot of the students will not have had the first year of law school and, won't be trained sort of legal thinkers. We have to really, take the courses and make them so that they're reachable and approachable by everybody, even without a law background. So, but yeah, there is some overlap. I think that students who have taken some health law courses in law school may end up seeing a little bit of overlap, but we're coming at it at a different approach, and I think that I don't think that anybody's going to really have unless they've if they've taken all the different kind of courses that we've offered that we're offering in the HPL, then we certainly want to talk to that student about maybe going through the policy track so they're not going to be doing too much redundancy.
Fantastic. And in terms of the specific courses, how are students generally tested? Is it done through online quizzes, essays, or other means?
All of the above. It's definitely not going to be the classic law school model where you take an exam at the end of the semester and that's it. We're going to be offering, and I'm very much in favor and an advocate for letting students find out early on how they're doing and to really be taking evaluative tools throughout. Students are going to be, in my course in the U.S. Healthcare, for example, on the first quarter, students will be answering discussion questions as part of their sort of participation. They're going to be given homework assignments, sometimes a short paper, sometimes a quiz. A lot of sort of multiple choice, short answer type things, and all the professors are really going to be using all different kinds of modalities to help with evaluating students and allowing them to kind of participate and sort of get a sense for where they're doing in their progress with the course. So it's going to be it's going to be a lot of work for us because we have to, all of that, the more we do of that, the more we have to put it together and the more we have to, grade those answers and that kind of thing. But we think it's going to add a lot more value to the course that way.
I think one of the exciting things about this program is that, again, since it's being built from scratch, there aren't a lot of sort of legacy things left over, right, where a quiz has always been done at this point in the term, or this is the essay that we are now asking students to do for the 15th straight year. This is all brand new, and so the assessments are really, really carefully thought of in terms of their unique ability to determine how a student is progressing in the courses.
Yeah, that's right. I mean, it's an advantage and a disadvantage. The disadvantage is that we don't have anything to build on from previous experience, but the advantage is that we're really creating something with, as you say, with a focus on these folks, and we're going to know more too, and be able to even further tailor kind of how the courses work once we see who the cohort is of our admitted students. So, but yeah, and we will, it'll be able to then build on that knowledge as years to come after the first group of students tell us what they felt about it. So we'll be looking forward to their feedback as well.
Great question here. For the capstone, can we potentially collaborate with a classmate?
Yeah, I would think so, and that's another question for Professor King or Professor Dohan, but I would think that in the capstone project they're going to be able to collaborate with other students. I can't say for sure. We can certainly get back to them with a more definitive answer on that.
Yeah, that's a great question, and to build on Greg's point, definitely that's one that, again, if we have your email address and your contact information, we'll talk to the two other faculty co-leads who are really involved in the capstone and see their thoughts on that. But it certainly seems like it reflects kind of the spirit of the program, which is to not only teach from the faculty point of view, but also get a lot of collaboration. I'd certainly know from the assessment standpoint and looking at the admission side, that the program is really significantly about bringing in students who have significant experience and backgrounds or points of view that they can share. So it certainly would seem like collaboration on the capstone would be a great opportunity.
Yeah, and in other areas too. I mean, the discussions that are going on and the discussion parts of each week's assignments are going to really allow students to talk with each other either through that discussion room or privately. Certainly people are going to, and there will be assignments from in a lot of courses where students will specifically be asked to collaborate with each other on projects. So there'll be a lot of inter-student collaboration with faculty, collaboration with possibly even some of our guest lecturers, and we're having a lot of guest speakers and guest interview subjects coming in for the course as well.
Well, you answered the next question, which is what other means of collaboration are available?
Right.
Those sound like the big ones. I'm curious, I think this question came in a little bit earlier, any thought yet around students physically getting together? So figuring out ways to maybe visit campus occasionally or meetups with students, with a number of students who may be in the same area?
Absolutely. We're trying to think about that already. We're already talking about kind of whether professors should be holding live office hours as well. We'll know more once, of course, we get everyone enrolled as to where people are geographically. But we don't want to close it down to people who might have an opportunity to meet regionally, geographically. So we're definitely looking into that and hoping to make it available.
So last call for questions. I think if we don't have any more questions that have come in, then at this point, we'll probably give you a little bit of extra time back, 10 minutes to finish your lunch if you're here Pacific time. Otherwise, if you had a question that we didn't see come in or we didn't have a chance to get, again, by all means, let us know. Get in touch with us another way so that we can follow up with you either directly from a faculty member. Gregg may be the best person to answer that, or with an enrollment advisor who's available to speak anytime. And with that, then, I'd like to thank you all for your time. Again, wherever you are in the world, you took an hour out, whether it was from dinner or from lunch or from breakfast, to join us today, right in the middle of your busy day. So with that, we hope to hear more from you and be in touch. Don't forget the application deadline is June 15th, so it's coming right up. You have plenty of time to get your application together. Again, since the GRE is optional for this program, if you are not planning to take the GRE because you have particularly the quantitative and analytical skills to demonstrate from other parts of your background, you have plenty of time to get the recommendations, the essays, and the other components together. So, but again, by all means, get in touch with us if you have any questions about that. So with that, have a wonderful day, and again, thank you for your time.